Good morning. I'm Rachel, and I'm going to be talking to you about articular inflammatory syndrome. Here's that. So some of the clinical manifestations that accompany articular inflammatory syndrome include inflammation, stiffness, and limited joint range of motion. So we know that a syndrome is a collection of signs and symptoms that characterize a disease, while the disease is a pathophysiological response to internal or external factors. Diseases are specific, syndromes are very broad. So the three syndromes that I chose to look at are inflammatory arthropathy or inflammatory arthritis, juvenile osteochondroses, crystal-induced arthropathies, and degenerative joint disease. So first of all, we're going to talk about inflammatory arthropathies. These are a group of diseases that are characterized by inflammation of the joints and other tissues. They're typically autoimmune diseases, and genetics play a very important role in the causation of these diseases. Most of the times the cause is unknown, so scientists believe that there's a strong genetic basis. Most inflammatory forms of arthritis are systemic, meaning they are very broad and they affect the entire body and aren't just localized to one portion. So some examples of inflammatory arthropathies are rheumatoid arthritis, systemic lupus, erythematosus, psoriatic arthritis, ankylosing spondylitis, and juvenile idiopathic arthritis. Second, I said we were going to talk about juvenile osteochondroses. These are a group of children's diseases where degeneration or necrosis occurs at a growth ossification center. So it occurs at the end of, say, a long bone. And it's followed by regeneration and subsequent deformity. These may be caused by a genetic causative factor, again, as we had talked about before, or trauma. So in the juvenile osteochondroses, there's two different types. There's an osteonecrotic osteochondroses, where the bone actually is dying and causes this disease. This would include Legg-Calvé-Perthes disease, Feinbergen fraction, Panner disease, and Kienbock's disease. And then there are also abnormalities in ossification in the cartilaginous tissue due to trauma or genetics. So these are possibly not quite as severe, still very bad, but not quite as severe as the osteonecrotic osteochondroses. So the abnormalities in the cartilaginous tissue would include Osgood-Schlatter's disease, Blount disease, Sever's disease, and Schuerman disease. Next, we're going to talk about crystal-induced arthropathies. So when these happen, there's a crystal deposition in the joint, which produces arthritis. Typically, we see this with gout or pseudo-gout, and chondrocalcinoses kind of mimic gout. The crystal-induced arthropathies are typically caused by a metabolic disorder that affects the joints, and they're associated with high uric acid levels, though not necessarily. Just because you have a high uric acid level does not mean that you're going to suffer from a crystal-induced arthropathy. And the other syndrome is degenerative joint disease. So typically this includes osteoarthritis. And the joint changes from OA result from inflammation, which occurs when the cartilage is damaged and attempts to repair itself. It results in spur formation. So OA and any of the degenerative joint diseases cause loss of articular cartilage and synovitis. They cause inflammation and joint spurring. And then some of the risk factors for that include old age, history of OA and other joints, neuropathy, and obesity. So the three diseases under the articular inflammatory syndrome that I wanted to look at include rheumatoid arthritis. So rheumatoid arthritis is a systemic inflammatory disease, and it typically affects the joints, typically the small joints of the hands, fingers, hand, wrist, but it can affect other joints. The cause of rheumatoid arthritis is unknown, but it suggests a genetic predisposition towards the disease, towards joint inflammation. Joint involvement is typically symmetric, so you would have, say, this MCP joint on your right hand is also inflamed on your left. Both are painful. They typically affect the PIP joints and the MCP joints, not typically the DIP joints. In general, rheumatoid arthritis develops a soft, spongy feel to the joints. This just means that you can't really feel any additional spurring as such as you would in osteoarthritis. So because rheumatoid arthritis is a systemic disease, it may also cause fatigue, weakness, anorexia, and weight loss. Typically, you can't diagnose rheumatoid arthritis with an x-ray, and they often have to be diagnosed through lab testing. Rheumatoid factor isn't conclusive, but it can help. The anti-CCP autobodies have a higher specificity to detecting RA, and that can help detect erosive versus non-erosive forms of the disease. So next we're going to talk about osteoarthritis. I know I mentioned it briefly in rheumatoid arthritis, but this is a general wear and tear disease. As I had said before, it's categorized in the degenerative joint diseases. There's no positive inflammatory markers. There can be, but typically no. They have like an achy pain. It can be localized to just one joint. There's no symmetric, like if I have osteoarthritis in this wrist, it doesn't mean I'm going to have it in this wrist. This can be diagnosed with x-rays because it will show the spur formation, as we talked about before, that you can see when the cartilage degenerates and then creates the additional bone. And the osteoarthritis produces a hard feeling when you're testing for joint mobility. And then gout. Gout and rheumatoid arthritis and osteoarthritis can all be confused together. Gout is characterized by a high uric acid level and crystal deposits. So you can have crystal deposits in the joints or in the kidneys. They have severe gout flare-ups that result in inflammation. Again, you can get like the crystal deposits can accumulate in the articular surfaces, the bone, the cartilage, and the soft tissues. There's four phases of gout. As the gout progresses, it typically worsens. Gout typically affects the first MTP joint, and it's an abrupt onset of pain. And as the disease goes on through these 4 stages, it tends to get worse. So some of the differences, like how do we know something's an articular inflammatory syndrome versus degenerative disc disease or degenerative joint disease or the juvenile osteochondroses? So the inflammatory arthropathies, you can take cultures of the inflammation. The inflammation is typically worse. You run labs on these patients, and they should indicate some sort of inflammatory marker, whereas the osteochondroses, the degenerative joint diseases, and the gout, they won't have those same markers that you would in the inflammatory arthropathy.